works over at man, it's taking care of adults, right? Babysitting. Yeah, start right here. That's a stressful job. Originally came in with. Uh-huh. Part for Megan is where these shoulders really start to come and drop off on the neck. So really bringing some release of tension through this middle area has been a game changer for her. Good. Hips are rotated here to this left side. Get some pushback here on this right PSIS, this hip's not wanting to glide through like it should. And it correlates always with the shorter leg. So we're going to address this hip first. Come on this way for me. This adjustment itself is going to be actually an uninvolved side up. So we're actually addressing the right side that's down, but we're looking to actually lift this left side through like that. Let's go on your back. We can recheck leg length here. Back to equal. Checking overall hip rotation here, just how she's lying front on the table. We're still seeing some hip drop here on this side over here. Go ahead and face me this way. So this time addressing into the lumbar spine. Good, on your back. Rechecking, because of course never guessing. And there, hips are nice and neutral. Feet are level. Addressing the neck. Feeling in, we have C7 at the bottom, then C5, which is really the middle of the neck, so people that start to lose the restoration of their curve. C5 is a very common primary that we'll adjust. Just looking to lift and push that segment back into the correct position. And then going lower. Good. Shoulders are nice and level. Come on up. Beautiful, Megan.
I feel like $1 million right now.
Like $1 million.